To have you with us here. Obviously, a huge concern with this entire crisis has been trying to make sure we have healthcare capacity to treat and test everybody who needs it. What are you doing at your facility specifically? And I guess what volumes are you prepared for at this point? Do you think you have that under control?
Well, first of all, great to be here with you today, and great questions as we think about the uptake of this virus across the country. And certainly there's a lot of concern. There's a lot of anxious people. The healthcare systems here locally, and Santa Clara has been one of the areas that we have seen more uptake than other parts of the country. We've been working very closely with local county officials to make sure that we're doing the right things to be able to be prepared. Not only does that mean internally, as you talked about, we have been able to develop a novel test actually here at Stanford that's allowed us to be able to test COVID patients and actually get results back in 12 to 24 hours, which goes a long way in mitigating some of the fears that patients have coming in. That's allowed us, as you shared, stand up these drive-through clinics. And actually patients can be screened with their primary provider right online, so they don't have to come in and actually right from their car and receive the nasal swab for the test. So there's a lot of things being done. We're planning locally. Certainly concerns with how quickly will this uptake, how quickly will we see patients coming in. But a lot of planning that's taking place with what we're doing both from our general acute care capacity, but also ICU capacity, because as the disease progresses, certainly that becomes one of the areas that we're looking at. And some of our modeling suggests that, of the positive COVID patients, anywhere from 10 to 12% of those could eventually need an ICU bed. And so we want to make sure that that capacity is here, and there's a lot of planning and effort. But as we've seen here locally, there's a steady uptake, and we're not seeing some of those vast uptakes that we've seen in some of the other areas impacted by this virus.
And you've run other large hospital systems. Do you think, holistically speaking, there is the ability to add ICU capacity and stay a step ahead of this? Or do we just not know yet because testing is in such an early phase?
I think, and let me say something about testing, too, because I know a lot of folks are anxious about this and, can I just get the test? We want to make sure that we're cautioning folks to follow the CDC guidelines in getting the test, making sure that the viral loads are a point where the test can actually be accurate and we can tell. And so that's certainly something that we've seen here locally that's important. I also sit on the board for the American Hospital Association, and I know there's a lot of tremendous healthcare organizations around the country that are planning and prepping for just that piece. We do have the opportunity to flex, and when we look at what we need to be able to meet the needs, we want to make sure that those are online. Certainly as a county of Santa Clara, there's a lot of prep work that's being done about how do we spread that potentially across the whole system so that we're not just looking at some of the centers like Stanford Medicine to respond to that. But there's a great network of hospitals and healthcare organizations around the country that are doing similar planning.
I wonder, the public's being showered with headlines about the unavailability of tests, but there's other supplies you need in order to conduct those tests. What does the supply chain look like on that front, swabs and so forth?
Sure. No, that's a great question. One of the hot topics, in fact, you've had on your show already today, is to talk about personal protective equipment. One of our highest priorities is to make sure that the healthcare workers that are needed to be able to respond to the patients coming in are protected from that. We are seeing across the country shortages in some of that PPE equipment and the availability. So whether you're looking at masks, whether you're looking at gowns and other things, certainly there's a high utilization of that, and we're certainly taking all opportunities. Some of the areas that we're manufacturing those around the world certainly have not been able to produce some of that. So a lot of great sources out there. As you mentioned, even nasal swabs, some of those that we were using are coming out of Italy, which is being challenged as well. But we're looking at other sources and other manufacturing, and we've seen companies that are actually stepping up their production in other areas that we haven't seen before. So while we continue to receive shipments that are coming in, we certainly are cautiously optimistic that we're going to be able to have the supplies that we need.
We've heard plenty about various, across the healthcare system, people essentially deferring elective procedures and things like that to try and preserve the ability to treat those who need it right now. But in terms of your hospital there, are you able to handle other more urgent needs along with doing what we need to do in terms of testing and treating of the COVID victims?
Great question. I mean, one of the things that we're a tertiary quaternary center here at Stanford Medicine, and we do have some of the best resources in the country. Those continue. People continue to have accidents. They continue to have heart disease. They continue to have cancer, and we've got to be able to create the capacity for that. We have, and if you look at the county here, delayed elective procedures. If those things, without causing harm to the patient, can wait 30 days or more, we've asked those patients to postpone those procedures. That's going to be an important impact to be able to have the capacity that we need for potential COVID patients that need to be inpatient, but at the same time making sure that we're treating those diseases that are progressing and need to be cared for. Unfortunately, the healthcare in many cases won't stop. And if all of those things are delayed, then you are creating a bolus that will actually build up in the system, and it's going to be difficult to manage. So we want to make sure that as a community resources, we feel a moral obligation to be there for our patients and to make sure that we're providing the services that they need, while at the same time being able to respond to issues like COVID.